Alright, so this week we're looking at the abdominal exam. First thing we're going to do is we're just going to inspect the abdomen, just look for any bruises, scarring, anything like that. Next thing we're going to do is use tangential lighting, which normally I'd use a pen light, but mine's out of battery today, so we're just going to use a phone and we're just going to shine the light tangentially on the stomach, looking for any abnormalities. Looks good to me. So good. Next thing is we're going to auscultate. So the first thing we're going to do is just auscultate for some bowel sounds. Here we're just going to go to all four quadrants, left lower, left upper, right lower, right upper, and we're just listening for the bowel sounds, making sure that we hear it. Should be about 5 to 15 seconds. If you can't hear it, make sure you stand there for 2 minutes to hear for something, otherwise that's a big problem. So the right lower, good, the right upper, good, and then we're just going to move over in a clockwise manner, making sure we hear the sounds. And just like the previous video, this should be done skin on skin, but it's cold here in Minnesota, and no one wants to take their shirt off right now because of that, so we're going to keep that going. For that one, we're using the diaphragm. Next, we're going to be listening for the arteries, and that's for bruits. So we're going to go to the aorta, renal, iliac, and femoral arteries. And as we've done in the past, we're just kind of going down like a ladder formation. Next thing is we're going to use the bell to listen for liver and spleen friction rub. So yeah, we're going to start with the liver. Right in the right upper quadrant, we're just going to have you do a little sit up here. Good. Alright, and then same thing here with the spleen, just do a little sit up. And we can hear that friction rub, so that's great. Another thing that I didn't mention in the beginning of the video, you're going to want to make sure your patient's knees are bent at like 90 degrees because it's going to relax the stomach, otherwise it's real stretched out. Don't have their arms up above their head, just have them real comfortable so we can really hear exactly what we're supposed to. Next thing we're going to do is percuss the abdomen as a whole. The way that we're going to do this is we're going to start with 3 lines, kind of split the body. So we're just going to start over here and go down. You can listen for the different sounds that when we're going over our organs and other things like that. Good. So next we'll be percussing for the liver border. So I'm actually going to go on the other side of my patient for this one. And we're going to start down below. If it's a female patient, there might be tissue barriers that you need to ask them to do so you don't go past any boundaries. So I'm just going to start low and just listen for the dullness of the liver as I move up. So we can hear it right here. I'm going to have the patient place a finger right here, and then we're going to go try to find the upper border. And same thing, once I feel it, we're going to put our finger there, and then we can measure the distance between here to see the size of the liver. Next after that is we're going to percuss for the spleen here. Again, switch sides of the table, like be on the opposite side. And we're just going to percuss for the spleen until we can hear that we're on it, and we can just kind of percuss the boundaries of that, and that's just to see the general size of it. And then if we have any problems, we can deal with it then. Murphy's kidney punch. So for this one, we're going to have our patient sit up, and we're going to place our hand over like the TL junction rib cage area over here. We're just going to give it a nice little hit, and what we should feel is just like the kidney kind of softly touching our hand as we do it. Make sure you do that bilaterally. Good. Thank you, patient. You can lay back down. So next, we're moving on to the rebound test. We're just going to kind of reinforce our hands. We're going to be pushing in the lower left quadrant, and we're expecting, if there is any pain, we're expecting that it would be in the right lower quadrant, but on a normal patient, you wouldn't have any pain. So I'm just going to push a little bit here, rebound back. Is there any pain with any of that? No pain, that's good. So For the next test, we're just palpating the general abdomen again, but we're doing it more specifically, like rubbing each area, each quadrant. We're going to go superficial, and then we're going to go deeper, and we're just going to go in a clockwise manner, starting at the right lower quadrant, just palpating all the organs in there. You can feel, you might be able to feel any bowel movement. And the next one, you just go a little deeper. Don't go too deep where you hurt your patient or anything like that. Ask them if there's any pain, and note if there's anything that feels abnormal to you. Good. Then we're going to palpate for the liver's edge. To do this, there's 2 different ways you can do this. I'm just going to go in there with reinforced hands right below the rib cage on the right side. I'm going to have him take a deep breath in and out. And as he's taking the breath out, we're going to push P to A and I to S and try to get up under that rib cage and feel, you can feel the inferior edge of the liver. Next is Murphy's. So we're going to try to find the gallbladder basically. For here, we can do the exact same thing where we just have him take a deep breath in, deep breath out. And the gallbladder is right on the inferior edge of the liver, so we should be able to push P to A, I to S, and feel that gallbladder in there. So the spleen here, we're going to get on this side, and we're just going to get one hand under, one hand on top, and we're just going to kind of squish the spleen and try to feel the spleen here. Then the next thing we're going to try to feel for is the aorta. This is right by the xiphoid process. We're just going to go right up here and just kind of lightly push. Should be a little bit off to the patient's left. Lightly push and see if we can feel. We should be able to feel like a pulse coming on our fingers a little bit, or just tapping our fingers. Next is kidney capture. So this is just, we're going to squeeze from the bottom and squeeze from the top, kind of squeeze the kidney together and try to see if we can feel it. So we're just going to get one hand under. The kidney would be on the back, one hand on top, and then we just squeeze together. And this would be done bilaterally. For sake of time, we're just going to skip that. So another rebound test here, and this is for appendicitis. So appendicitis would be in the right lower quadrant. We're just going to do the same thing with the reinforced hand. Push down, let it rebound, and then we're going to ask our patient, was there any pain with that? No pain, which is good, otherwise that could indicate appendicitis. So next one is McBurney's point. That's 1/3 the way medial from the right ASIS. So right ASIS, right here, we're just going to kind of feel for it. Again, if there was any problems here, he would have a lot of pain with that. So the last thing to check is the psoas and obturator sign. So for the first one here, just have the hip at 90, the knee at 90, and then we're going to have him resist against, I'm going to try to push and don't let me push. Good, any pain with that? All right, and then for the obturator sign, we're just externally and internally rotating the hip, and is there any pain with that? Good, so that's negative for both tests, which is a good sign. And that concludes our abdomen exam.